Hi, my name is Afifah, and today I will be presenting on equine keratomycosis. Equine keratomycosis is a common ocular condition that occurs throughout the year. Kerato refers to the cornea, while mycosis refers to diseases that are caused by fungal infection. In southern United States, it has been observed that the majority of equine keratomycosis are reported between October and January. This might be attributed to the warmer climate in those regions which is favorable for fungal growth. Despite this trend, there have been a reported increase of keratomycosis in temperate regions in recent years. Fungus lives as commensals on the surface of horses' eyes. 95% of all healthy horses in Florida have commensal fungus found on the surface of their eyes, and they live symbiotically with bacteria. Commensal fungus is not harmful to the horse until there is an opening in the cornea which causes the fungus to enter the interior of the eye. Opportunistic fungal infections are usually a result of corneal trauma. Horses have large prominent eyes which exposes a large portion of the cornea to the environment. This makes the cornea more susceptible to acquire injury through accidental contact with fomites. Injury to the cornea allows an opening for the commensal fungi to enter the stroma, causing ulceration. There have also been incidences where equine keratomycosis occurs after the treatment for ocular ulcers. This is because topical steroids are often applied to treat corneal ulcers. Steroids are administered for its analgesic properties. However, it suppresses the immune system simultaneously, which is detrimental for the horse as it becomes more susceptible to opportunistic infections. Affected horses display behavioral and physiological changes such as closing the affected eye involuntarily for extended period of time, moving away from sources of light, and excessive tear production. There are 5 different presentations of equine keratomycosis, and each one has varying degrees of severity. The most common form is one that has ulceration to the cornea that is surrounded by corneal swelling, with a prominent increase of ingrowth of blood vessels to the cornea, known as neovascularization. Secondary signs include inflammation of the uvea and an increased number of white blood cells in the anterior chamber of the eye. As the severity of the degrees progresses, the most painful form is corneal abscesses. This is usually a result of the corneal epithelium healing over a contaminated wound. There are different ways to diagnose equine keratomycosis. The most common is by obtaining a sample of the affected area by scraping the affected corneal surface. An anesthetic is applied to the eye to numb the area. Tissue sample is obtained by scraping various parts of the affected eye. As fungal infections often affect the stroma of the eye, it is imperative that deep scraping is conducted to obtain cells from the stroma. To maximize accuracy of the diagnosis, the veterinarian would conduct multiple scrapings. Upon obtaining the sample, cytology is conducted using the Diff-Quick stain. Alternative forms of diagnosis that could be done include culturing the specimen. It has been found that the most common fungus is Aspergillus. The type of fungus usually varies with the geographical location. A new diagnostic tool, which is non-invasive, is laser scanning confocal microscopy. This technology is highly useful as it is able to detect presence of fungi in deeper ocular tissue layers without causing further trauma. This technology is fairly new and is used in larger practices. The last resort is removal of the eye, known as enucleation, for histological examination. This is only conducted if the eye cannot be saved, as these procedures are highly invasive and also expensive. Depending on the owner and the utility of the horse, The horse may also be rendered useless if it loses its sight and may not be worth the investment. Treatment is possible in the early stages of equine keratomycosis. It is important to note that horses that present keratomycosis with an ocular furrow seems to have minimal chances of being salvaged. Veterinarians will have to treat the fungus as well as the inflammation of the eye simultaneously. In general, veterinarians consider three factors prior to administering an ophthalmic antifungi: ease of administration, drug toxicity, and the depth of tissue penetration. Drugs are chosen based on the severity of the disease. Some common antifungal drugs include topical miconazole and natamycin. As the animal is often immunocompromised, ocular bacterial infection is commonly found along with fungal infection. Therefore, antibiotics are often prescribed. Veterinarians will not only have to address the fungal infection, but also ocular inflammation, such as inflammation of the uvea, inflammation of iris and ciliary body. Inflammation may worsen after antifungal therapy has begun, as fungal death mounts a greater immune response. Flunixin is a non-steroidal anti-inflammatory drug which can be administered orally or via intravenous injection. Atropine can also be used as an analgesic but should be applied with great care, as it has been documented to cause colic in horses. If the horse does not respond well to the antifungal and anti-inflammatory treatments, a last resort to save the eye is anti-enzyme therapy. Serum from the affected horse is obtained and applied to the eye. Serum contains anti-proteinase enzymes, which help promote corneal healing. This method is seldom utilized as it requires refrigeration and causes discomfort to the eye. If this treatment fails too, then surgery becomes a possible resolution. Surgery is a common solution, with more than half of equine keratomycosis patients receiving a combination of surgical and medical intervention. An example would be conjunctival grafts, which involves transplanting a part of the conjunctiva to cover an ulcer. Corneal transplant, on the other hand, involves transplanting a cornea from a different horse to the patient. Theoretically, there should be a 90% success rate for equine keratomycosis treatment. The prognosis, however, in reality is rather poor, as the percentage of vision gained after treatment is approximately 50%, and half of the patients still become blind or require their eyes to be removed. Most patients with keratomycosis suffered from bacterial ocular ulcers as well, and the prognosis of these patients were often the most difficult to predict, as outcomes were highly variable. The disparity between such a poor success rate could be attributed to late medical and surgical intervention when the eyes could still be salvaged. Therefore, in conclusion, equine keratomycosis is an important disease that horse owners should be aware of, as it is a disease that can easily be prevented. As this disease is predominantly caused by trauma to the eyes, owners should take necessary precautionary measures to minimize the number of sharp edges and the amount of dust in the horse's environment. It is important to observe a horse daily, and in the event that an ocular trauma has occurred, it is best to immediately contact a veterinarian to assess the horse's eyes and treat if it is necessary. The rule of thumb is early intervention, as then the prognosis will be good and the patient will be able to recover from the disease condition. A blind horse is most likely an unwanted horse, and since this condition could be prevented and treated, Education is pivotal in minimizing the incidence of this disease. These are my references, and that is all I have for my presentation today. Thank you for listening, and if anyone has any questions regarding the presentation, do not hesitate to email me at afifah@iastate.edu. Thank you and have a great day.